Tomorrow, KPMG Bermuda will spotlight the work of Dr. Karin Lemmens, partner at KPMG in the Netherlands and a leading specialist in mental health system transformation, for a keynote presentation alongside co-speaker Charlotte Reboul, senior manager at KPMG in Bermuda. Joined by Dr. Ed Fitzgerald, head of healthcare for KPMG Islands Group, they say that cross-border and cross-sector collaboration will be key if the country is to successfully meet future challenges, bridging gaps in mental health care services and systems.
Historically, mental health hasn't been talked about, and I think that has been an issue internationally, and I think it's really good that today people are feeling much more able to have a conversation. I think if you think about physical healthcare conditions, it's normal to talk to a doctor about your diabetes, about your chest pain, and for too long people haven't felt able to talk about mental health care, and unfortunately that's ended up leading to bigger problems later. So trying to move towards a system that supports wellness and prevention and encourages dialogue and recognises these problems in a way, I think many nations are on a journey in that respect, and I think Bermuda is on that journey as well.
It's really great to see that there's the momentum right now. We see that on the one hand, what Ed just mentioned is that it's very important to in the way you look at healthcare. It's not only looking at the disease, but also at the health and the possibilities of people. So that's really a paradigm shift we're looking at. On the other hand, it's not only around stigma, but it's very important to also build the networks around the people with the mental diseases, and also connect those people themselves, but also their own networks in that system, but not only the government or the mental health organization, but it's very important to connect the communities. So there's actually a lot of opportunities we see also here. Yeah,
we're seeing a transformation, and it's great. I think we're seeing momentum in transformation in how people talk about mental health. There are very courageous individuals in Bermuda that are now speaking up with lived experience and willing to share what it's like to live with mental health condition. But there's still work to be done, I think, on stigma, and it's exactly to your point. It's a community-based approach where we need stakeholders to work together. It can't be led only by one group of people. It needs to become a conversation that everyone feels comfortable in having, and KPMG has a role, and that's what we're hoping to do this week by bringing international experts to talk about what we're seeing in other jurisdictions. But in our community, it's nonprofit organizations, it's care providers, it's insurers. Everyone needs to be or feel comfortable to be part of that conversation and talk about mental health like you would talk about any other condition, really. And once I feel collectively feel as comfortable, then we'll have, I think, tackled the issue of stigma. And hopefully the younger generation feels is leading the way.
Gray Miners reporting for Bermuda Broadcasting News.